Good afternoon, my name is Ahir Abbas. I'm one of the clinicians here in the emergencies department. Can I confirm your full name and date of birth, please?
Yeah, Nasiruddin Patel, date of birth is 11th May 2000.
Nas, Nasiruddin, Mr. Patel?
Nas is fine.
Nas, thank you. How old are you now, Nas?
23.
Nice to meet you.
You too?
Nas, I've been asked to carry out a blood pressure check on you. Have you ever had this done before?
No.
So there are two ways. There's the electronic version where the machine does it, but I've been asked to conduct a manual method. Is that okay with
Yeah.
you? What it entails is I'm going to place a cuff around your arm just at the top over here, and I'm going to inflate that cuff.
Yeah.
It'll be a little bit tight and uncomfortable, but it shouldn't be anything excessive. If it becomes too much, I just want you to say, and we can take it from there. Is that okay?
Okay. Yeah.
What I will need you to do is either remove the upper garment entirely, or just lift the t-shirt up so as to expose the upper arm, if that's okay with you.
Yeah.
Now, before we begin, do you have a preference to what, either arm?
I think right arm will be best.
You're okay with the right arm. And you said to me you've never had this done before.
No.
So, are you aware of any blood pressure issues that you might have?
No.
Are you on any medications?
No.
Fine. And any history of cancer or surgery on this side?
No.
Any implants in the arm?
No.
Any pain or discomfort? Any infections or rashes?
No.
Lovely. Are you happy for me to proceed? Wonderful, thank you. So I'm just going to go through again various steps. If there's anything you want me to, if you want to ask me, if you want me to stop any time, like I say, don't hesitate.
Yeah.
When was the last time you had a cup of tea?
This morning.
Coffee? So what, about 3 hours ago?
Yeah.
Lovely. Good. And how long have you been sat in a waiting room for?
About 20 minutes.
How are you feeling? Apprehensive or you okay?
I'm feeling calm.
Good. Yeah. Good. So, just get a pair of gloves on now. Okay. And I'm just placing this over here. That's good. And have you okay just to lift that up for me, please? That's good. Thank you very much. And nice and relax on the arm, that's good. Good. I'm now going to inflate the arm, okay? I just want you to relax as best as possible. Not feeling apprehensive or anything like that, are you? Good. Straight now. You okay? I'm now just going to place this onto the actual arm itself. Now, just before I do that, I'm going to raise that up a little. Can I just get you to bend your arm for me? That's good. Okay, and relax completely. Okay, I'm going to inflate again, okay? Wonderful. Thank you very much, Nasiruddin. That's everything. Thank you. Do you have any questions for me?
No.
Lovely. Well, that's everything for today. I'll document the results. Just so you're aware, the blood pressure was well within normal limits. It was 114 over 76 is what I calculated.
Yeah.
Do you have any questions for me at all?
No.
Lovely. And that's wonderful. Thank you for your time. I'll get the results documented and then we'll call you back when necessary.
That's
okay?
fine. Thank
Stay
you.
safe.
Thank you.
In terms of the blood pressure itself, so what I did in terms of the method was I assessed the radial pulse, I inflated the cuff, and watched the actual the sphygmomanometer until it completely obliterated the radial pulse as from what I could feel. I made a mental note of that value, and that in the given situation was 120. On the second occasion, what I then did was I palpated the pulse here in the antecubital fossa, and to locate that, what I did was I placed my hand over the antecubital fossa. I asked Nas to actually bend at the arm. As he did that, the tendon of the biceps brachii muscle came into my fingers. I then dropped medially from that, and that's where I was able to feel the actual artery itself. I then placed the diaphragm of my stethoscope on that region. I then palpated the radial pulse again, and this time I just inflated at 20 millimeters of mercury above the 120 that I got initially with the obliteration, i.e. 140 millimeters of mercury. I then reduced and deflated the cuff at about 1 to 2 millimeters of mercury per second until I started to hear the chord cough sounds with my stethoscope. The sounds are reflective of the blood rushing back through the artery. They go from light to more prominent, and what I was looking for was from the sounds starting, i.e. the first chord cough sound, until the most loud before they start to become muffled again, and that gave me my systolic and diastolic readings respectively, chord cough 1 and chord cough 5. And that's where my readings were 114/76 in the given situation here. Thank you for watching.